Good day, everyone. I'm Mel Spooner, Cause MD, and I'd like to introduce you to my fellow co-founder and Cause Education Director, Dr. Cole Robertson, who is joining me today.
Hello, folks.
In today's session, we are going to frame up the beginnings of how to embed a COVID-19 rehabilitation program into your club services. We've talked a lot as a sector about the role that fitness and good health plays in the prevention of the worst types of symptoms that someone who's endured COVID-19 might experience. But we've talked a little less about the role that we can play as a sector in the rehabilitation of someone who has endured COVID-19, when in fact we can do both really well. Right, Cole?
That's right. The important thing is the messaging is consistent. So the types of behaviors and practices that we advocate with regards to prevention, with people increasing their physical activity, structured, meaningful exercise, making some better informed nutritional choices, and starting to consider those lifestyle behaviors that are putting them at risk. Well, these are all the things that in the wake of someone having dealt with it, they need to start to figure out and to manage. But particularly where we come into our own is that structured, prescribed physical activity, how that can blend seamlessly into lifelong exercise behavior. And then all the way through that, those dietary, those nutritional choices that better place the individual to have longer lasting health and wellness, and therefore have a better functioning and optimally functioning immune system.
When it comes to the population that we can communicate to with regards to the prevention of the worst type of symptoms that someone can endure if they experience COVID-19, we can obviously communicate that message to everyone. That message is relevant to the entire population, and we know that. When it comes to the population size of those that we can rehabilitate who have endured COVID-19, let's have a look at the size of that population and in reality, how many people we can help.
So in reality, we're talking about a global population, but more specifically, when we look at the statistics in the US, similar to the UK, 12 to 14% of the population take part in physical activity and exercise that's meaningful enough to bring about an impact or change on their health status. But when we look at these figures and we start to look at, since March of this year, and we start to see this profile of increased cases, and this is just the start. If we go across from here, which is where restrictions began back in March, and we had 1,734 confirmed cases, to where we are today, or more recently with 500,000 confirmed cases. What we need to recognize is that even with a vaccine, the fact is over the course of the next 18 months, 2 years, more and more people are going to encounter and deal with COVID-19. And actually, being fit is not preventative. The fitter we are, the more we can prevent the worst types of symptoms by managing our body mass, by looking at those factors that relate to our comorbidities. But the reality is that until we start to take ownership of these factors, until we start to manage it, we're not really going to make much of an impression on that severity scale with regards to symptoms. But we do need to bear in mind that globally, an average of 97% of people survive COVID. So it's not a mortality issue in the biggest instance. Obviously, any one death is a death too many. But the fact is that really, particularly within the US and the UK, we're seeing 99 to 99.5% survival rate. What we need to look at are these growing numbers of people who've had it and what that means with regards to managing and supporting their rehabilitation, their restoration, and their rehabilitation from having had COVID-19. And these numbers are just the start. Yes, some people are going to challenge this and saying that we're seeing more because we're testing more, but I would challenge back and saying that all we're getting now is a more accurate insight to the reality of how many people this is impacting upon. And what we are becoming more and more aware of as these numbers increase are more and more people talking about the multiple forms of long COVID and what that means to be a long hauler, and also the long trail of complications and people not being able to just go straight back to how they were previously. So right now we're starting to just really see and insight with regards to what's coming. We've got this notion of first wave and second wave, when all the epidemiologists in the world are saying that we never really got past the first wave, that what we saw was the first wave, and then that's blended seamlessly into the second wave, which is steeper, which is bigger, and we're going to see more people.
And I think what's interesting in the UK in particular that we've seen on our side is we're keeping a track of what locations in the UK are the most affected by COVID-19 in terms of COVID cases, which is where we're focusing a lot of the work that we're doing, and we'll come on to that later. But when we looked at that list a month ago, there was 3 key locations that were the hot topic of news and media in the UK. Mm-hmm. Just last week, that list grew to around 25 key locations that were a wider topic of conversation. And when we had a meeting here and revisited that list yesterday, another 10 locations were now added to that list. And not only just an adjacent location that was next to one of the locations previously on the list. And of course, spread over boundaries is going to happen in terms of proximity. But we're also starting to see, if you look at the map of the UK, different areas of sort of high alert areas popping up across the country now, not just spreading organically because of they may already have been next to some location that was that had a high population of people with COVID-19. So the rate is speeding up. And if we're a sector that can step up and support those individuals who are experiencing COVID-19, let's have a look at what COVID-19 might look like so we can have an idea and understanding of what we might be faced with if we're to rehabilitate these individuals on the other side.
It's called a novel virus, which means it's new to all of us. Hi, my name is Charlie Peters. I'm 30 years old and I'm currently living in northwest London. I'm a professional Muay Thai fighter with over 13 years experience, but I'm currently transitioning over into endurance training. I'm working my way to a half Ironman later this year. I've had 67 professional Muay Thai fights, former 3-time world champion and the current UK #1. So I work at various gyms around London, taking group fitness, as well as personal training individuals to teach them boxing or Muay Thai. I cycle quite a lot around London and I'm always on my feet, walking anywhere and everywhere that I can. So I'm very, very active. So I got COVID.
I was having my 60th birthday on the 3rd of April. And so from the beginning of January up until then, I was on a mission and I was absolutely determined I wasn't going to hit 60 feeling less than my best self. So, you know, swinging 16K kettlebells and running around and doing all sorts and bouncing about, feeling as fit as a fit thing. I got back down to my fighting weight. I went to the supermarket at 7 a.m. and I think I got it there.
Hi, I'm Kate. I'm 38 from Warwickshire. I contracted COVID around mid-March. I'm now 19 weeks post-COVID.
So one thing I remember clearly from COVID is feeling how fatigued I was. I literally didn't do anything all day, but I just felt exhausted.
It's knowing what fatigue is different to tiredness. I felt absolutely fatigued, absolutely completely wiped out. Breathless going upstairs, total fatigue, absolutely wiped me out.
My initial symptoms were very flu-like and lasted only around a week. But the hardest part of it was the 3 weeks after that. And I really did feel super fatigued, really struggled actually to go about my daily business. And that was quite difficult. I'm an at-home mum of 2. There was a moment where I was quite afraid. The effort on my lungs was quite intense.
But I noticed my heart rate just shoot up. And even if I tried to run really slowly, my heart rate would stay high. I've done a lot of sprint work. Heart rate is a clear indication of how much stress the body's taking. That's when I knew something was quite serious. I was more so frustrated mentally. I'm so fortunate that, I've been okay.
My heart doesn't skip a beat normally, but I could feel my heart thudding in my chest. And I felt fatigued for 2 or 3 days afterwards. My neck I could feel my pulse in my neck. My head felt it was going to explode. After that, that took me really downhill.
Maybe I trained 4 times, maybe 5 times a week before. I do a lot of resistance work, mainly circuit-based. If I do any cardio, it is mainly on the biking side. Initially, just getting back on the biking side was really, really difficult, and I couldn't maintain long sessions.
So clearly I'm not unusual. There's quite a lot of people who are going down that road. All consuming, and just to walk downstairs and get a cup of tea was exhausting. And by the way, during the night, I've had this really, really weird pain in my head, and my cheek feels numb. And she just said, you've got to get an ambulance and get yourself to hospital quick, because you might be having a stroke or have had a stroke. They've said I've got some mild neurological nerve damage. If you go to a class and says, right, well, we're going to do an EMOM, every minute on the minute. I don't think my brain could actually process that as well at the moment. I'm really scared to start again, because I don't know whether it's going to trigger it off all over again. But I don't want to not start again, because I want to get back to myself. But I don't know when the right time will be to start.
It's not really how much you do. I think it's probably short and steady wins the race with this kind of thing.
So that can be as simple as a 5-minute walk on a treadmill, and at a given pace, at a given kind of incline, and it's just see how the body responds, and almost
try and figure out what kind of resources we need, what kind of testing we need, what kind of staff we'd need. So at least I'd say about 8 to 10 weeks since I've been feeling better. You get to learn your body in a different way, in a different manner. My body's never been through something like that. I've never been through it mentally and physically. So I feel like I've learned a lot more about myself. I've been extremely lucky. I've been extremely, extremely lucky. What you learn about yourself going through a battle like that is an amazing thing to happen. But I've been very fortunate and very lucky in comparison to many other people. So my thoughts are with them, definitely. Because it never stops. It never bottomed out. Without a vaccine, we are looking at a very different world for the next 2 or 3 years.
We need a new normal for everything, don't we?
So special thanks to Charlie, Jan and Kate for sharing their account of COVID-19 with us, and to Lee Halftek, who's an elite level rehabilitation coach and physiotherapist, and Dr. Mick Malloy, who is an emergency and disaster medicine specialist who we've been working with this year. It's important to point out as well, I think, that whilst what Jan, Charlie and Kate experienced has been quite extreme, it's certainly not been the most extreme example of cases that we've seen and witnessed. And also it's worth highlighting that these guys contracted COVID back in March. This video was filmed in July, and since July, sadly, all 3 individuals have experienced a relapse in terms of symptoms and chronic fatigue. It's worth stating that without knowledge, guidance, and the right information, it's very possible for individuals to try to self-prescribe their own way out of their situation, which is going to, in some cases, create more harm than it is good. Carl is now going to talk us through some statistics which speak to this reality of COVID-19.
Yeah, but just before I do, Mel, just on that point, which I know we're going to come to in a moment, this is where that kind of notion of, this idea of expectations of where you were before, and Charlie's a good example of this, and someone who's quite informed and wanting to get back to where they were. This is the misleading element, and I'm going to come to that in a second. What else is misleading is this notion of putting all the attention on death's mortality, because this data, which came out in the summer back in July from Professor Vo, this is really compelling and provides far more of an insight with regards to even a different perspective of the severe end of COVID-19. So most people don't end up in hospital who have COVID-19. It's really important to stress that. We don't want to sensationalize anything. However, for every person who does die, what we see are another 19 who require hospitalization. So it's perhaps an opportunity to look at those mortality statistics in a different way. 18 of those 19 will have permanent heart damage for the rest of their lives. 10 will have permanent lung damage. 3 will have a stroke. 2 will have neurological damage that leads to chronic weakness and coordination, lack of coordination. And another 2 will have neurological damage that leads to loss of cognitive function. So this is the more severe end that we have to manage. You know, this is the reality of those mortalities. This is the place, the real deep end. This is the acute clinical rehabilitation. And for most people, their rehabilitation will be non-clinical because they won't be hospitalized. So they're going to encounter and deal with COVID on their own terms and then have to pick up the pieces for themselves. And that's where the problem creeps in, because it's that lack of guidance and that lack of authority and expertise which is there to support and inform what those people do, what they should expect, and how they should start to manage themselves on the terms of their rehabilitation is crucial. It's crucial here for these people, these 19 who've also been hospitalized. Their early activation and their rehabilitation is crucial, but it's just as crucial for those who don't go to hospital. So this, I think, paints a far more compelling tale with regards to our statistics around mortalities and what that means for those who don't die.
When it comes to the guidance and lack in some instances thereof that Cole just spoke to, that's where we believe that we can step in as a sector. So when Cole and I first set up Cause as an education company, we never wanted to only sell education. We wanted to do something that would create a bigger impact on our sector. And in the context of COVID-19, that looks like this. And if we're talking about today and tomorrow, the future of fitness, how can we all pull together and collaborate now in the context of COVID-19? So we've been working together with strategic partners, brands, and club operators to grow this skills registry of coaches and trainers that have the confidence and competence and knowledge and skill set to work with individuals who need rehabilitation from COVID-19. And that might look like any one of these scenarios. So as we know, as we've experienced, as we've witnessed, there are existing clients and members, people who have an existing relationship with exercise, who have experienced COVID-19 and are seeking guidance, who are trying to self-prescribe and aren't sure where to start, and in some instances are making their scenarios far worse. We then have newcomers to exercise. So these are individuals who may or may not have had a relationship with fitness in the past. They may or may not have had a gym membership, who are also seeking guidance and support and have likely less avenues to go down to try and understand where they can get help. Within that group, and Cole will talk about this group in a moment, within that group, we also know that through COVID-19, there's a whole other population that has been dealing with chronic conditions of different kinds, cancer, diabetes, cystic fibrosis, throughout time. And what this COVID-19 period has done to them is raise their level of awareness around their own health and their vulnerability to COVID-19. And this population wants to learn too how they can bolster their health and prevent the worst case symptoms if they do contract COVID-19. So that's a whole other newcomer population that we can consider and get hands-on with as a sector. We can also forge new types of relationship with our primary care and community rehabilitation groups, wherever we are in the world. These are groups that are receiving individuals who have experienced COVID-19, but once they are out of that primary care, where do these individuals go next? As we've already mentioned a few times, these individuals are going home and trying to understand how they navigate their way out of COVID-19 themselves. But if we create a different type of relationship with these local authorities and these local caregivers, then those groups can start to signpost their patients and those with COVID-19 directly to us and entrust those individuals in our care. There's also a different type of conversation that we can have now with local corporates. As you heard from Jan in the video, Jan, we know from speaking with her that she's experienced all kinds of difficulty when it comes to returning to work, whether that's in her early phase of recovery, reading emails, driving to work, reading text for a long period of time. And we've read reams and reams of comments from individuals in Facebook groups that we're part of, where people are afraid that their poor performance by comparison to what it used to be, because of the effects that COVID-19 has had, is going to have a negative impact on their success at work and their review at work. So there's a role that we can play by educating local corporate employers on what their employees have been experiencing and how they can support their employees to rehabilitate through this process quicker. And it doesn't necessarily just end with those groups. There'll be far more. And just this week, we've had conversations with schools who are looking to help people at a grassroots level in their communities, or whom are looking for local skill sets that they can bring in to help with students who may have experienced COVID-19 themselves. So it's clear as a sector that we're best positioned to help. And what clubs are asking is, how can they get started and how can they get involved and start to provide rehabilitation programs locally amongst their communities. So here's the approach that we've been taking. This is hard to explain in a couple of slides, of course. So after this session, if people have questions, please feel free to reach out to us directly, and we'll of course continue the conversation.
Yeah, but when we're getting started, just to go through this content, it's vital that people understand what harm COVID-19 does. It's not the flu. And it's really important to emphasize that what it brings about is tissue damage to certain areas. Now, early days, everyone became aware of the fact that it would go direct to the respiratory system and that it was damaging, for want of a better word, perhaps the alveoli. We now know, further down the road, we know it directly attacks the hemoglobin in the blood. We know that it attacks neurological tissue. We know that it can go straight to cardiovascular tissue. So we know that it's far more systemic and far-reaching. And sometimes an individual might not encounter respiratory issues, and they might go to what you might consider to be a more advanced or a more complex set of circumstances. So it's really important that we keep ourselves up to date. We understand what is happening when a person contracts and is infected by COVID-19, because that's directly going to lead into what we need to restore and rehabilitate. It's not about just having a cold or a flu, whereby we don't feel great, we're non-optimal for a while, and then once we shrug off those symptoms, it's about just kind of picking ourselves back up and going again. What we need to be really mindful of is that we need to replenish and restore the system, that the system has undertaken or has been victim to some level of tissue cellular damage. And we need to look at how we can prescribe physical activity and exercise to best facilitate that restoration, that recovery, that leads into meaningful rehabilitation, which then starts to put a person on a better road towards regaining or achieving for the first time their fitness. Step 2 is all about considering the individual and making no assumptions, because every single person who's dealt with COVID-19 will give you an individual tale, and that's going to be influenced by their past medical history, whether or not they are dealing with any comorbidities, whether having COVID-19 has made them aware of underlying comorbidities they didn't realize they had. That's coming about quite a lot in more narrative as time goes by. We need to look at what is their capacity and tolerance right now. We need to become bespoke and individualized. And I know we talk about that a lot as an industry, but at the same time, We also know that one of the key downloads across our industry globally are template programs. So we know that, we like to talk a lot about individuality, but we really do need to be individual on these terms, because we need to set the pace that is sufficient for the individual to be stressed enough for that stress never to become negative and overwhelm the system and make a bad situation even worse, but sufficient enough to enhance that restoration, that tissue, that cellular restoration, to guide them meaningfully through their rehabilitation, and then start to put them in a position to move forward with regards to managing and acquiring new levels of health and fitness. And then our step 3 is literally that. So contact community and primary care. These populations, they're out there right now and they are growing. And what we need to do is we need to foster new relationships. As fitness professionals, experts, individuals, coaches, PTs, we need to establish new terms with community rehabilitation and with our clinical colleagues. Because right now, the latest evidence suggests that there is low confidence from clinic and medical settings in what we do, because there's an expectation that the fitness industry is just going to work people too hard. We need to change that. We need to become better informed. We need to extend our vocabulary so we understand these conditions within a language that's used elsewhere, and we start to build faith and trust from community rehabilitation, from primary care, and from the people who've been dealing with COVID-19 themselves.
So we've created a program that helps coaches and clubs to understand the pathology of COVID-19 and then run an individual through that assessment, prescription, program, and strategies for the future process. And this third piece, which, as I said before, sounds easier said than done, but because of the conversations that we've been having with our strategic partners and huge networks in care, in research, in employment, and so on, we're able to open up these channels of communication globally, but also locally. And in fact, our very original first Rebuild course graduate reached out to his local general practitioner upon graduating and has already received 15 patients that need help for long-term rehabilitation from COVID-19. So it is possible and it can be straightforward. When it comes to the future of fitness, our biggest, for want of a better word, concern is that we're going to open up the floodgates to tens of thousands of people that need help. And it's our responsibility and it's our role to be ready to receive them. Not forgetting, of course, and Colin and I are very big on this, but not forgetting, of course, that these concepts and principles that individuals are going to best understand by going through this learning process in the context of COVID-19 can be applied to all chronic conditions. And with regards to the same graduate that I just referred to, in their local area, their local population size is around 60,000 people. And we were talking with him the other day, Col, and we estimate that there's around 20,000 individuals in his local area that would benefit from his new expertise, but that's one person. So we need more than one person if, as a sector, we're going to pull together to make a change. So to help, we have prepared an accompanying video attached to this session. This video contains a series of canned responses to questions that we are regularly asked by clubs, coaches, and individuals who have endured COVID-19. Topics range anything from transmission of COVID-19 during exercise through to wearing face coverings, right the way through to the best time to restart exercise. Details of how to access that video will be around this video session somewhere, and you can access that video online, anywhere, anytime on the CORE's YouTube channel. We've also prepared a downloadable PDF that lists a series of frequently asked questions that an individual who has experienced COVID-19 is most likely to ask a practitioner. This is to help best prepare a club and coach for the types of questions that you are most likely going to be asked by someone who is seeking help as they try to rehabilitate out of COVID-19. Huge thank you for joining us in today's kickoff session, guys. Mr. Dave Stalker is certainly a hard act to follow, so thank you for joining us. COVID-19 is a huge topic and this is only a short session. So if you do have any questions after today, our contact details are on the screen and you can reach out to us anytime. Otherwise, have an amazing couple of days debating the future of fitness with Club Industry. And on behalf of Colin and I, stay safe.